Hi, so today we're going over stress tests or special tests for the wrist. So for this video, we are going to go over valgus, varus, TFCC, compression test, and lateral medial epicondylitis, a test for each of those. So without further ado, here we go. I have it there's no way to change the camera. I can. So first things first. First things first, can I touch you, Jay?
Yep, for sure.
So I'm going to begin with valgus.
This is right side is bad side.
Right side is the bad side. So again, I'm going to have him sort of supinate. That way it's an anatomical position. A valgus stress test is when I take his hand here, just sort of flip it, I guess, so the camera can see. And I'm going to try and make him radially deviate the wrist. So I'm just going to do that. I'm also going to palpate along the ulnar side of the wrist joint and just palpate with my fingers, just feeling for gapping. A positive would be excessive gapping or any gapping actually, and pain. Now for varus stress test, it'd be the opposite. So I'm going to have him ulnarly deviate his wrist. So I'm going to try and make him do it like this. And the way I would do that is, again, I would palpate the radial side of the joint and force it into ulnar deviation, feeling for gapping along this joint here.
So good side.
So on the bad side, if, for example, I'm going to do varus first.
There's pain there.
There's pain, that would be a positive test. Next would be valgus. A little bit of crepitus there, but that's okay, that was not part of it.
Little pain.
So that is the valgus stress test. Next would be TFCC. So for the TFCC, I'm going to have the athlete go into a state like this, and I'm going to have him ulnarly deviate. This will mean when I put pressure on his wrist joint, it will load through the TFCC. A positive test would be pain at the TFCC, which is right here in his wrist. So I'm going to stabilize my athlete below, and I'm going to ulnarly deviate and compress. Apply a pressure downward. So positive would be pain. I'll do it on the injured side now.
Ooh, tender.
Alrighty, I'll stop. That's a positive test. Next would be lateral medial epicondylitis. So lateral epicondylitis is the extensors of the wrist, and medial is the flexors. So for this, I'm going to have the athlete put his arm across the table. So this would be lateral epicondylitis. I'm going to lengthen and have him sort of match my resistance and try and force him down. A positive test would be pain at the lateral epicondyle of the humerus, so near his elbow on the outside. For medial epicondylitis, the test is you flip his arm into supination. I'm going to find his medial epicondyle right there. So that's the area we're looking for with pain. And for this, I'm going to have him meet and match my resistance while stabilizing his elbow. A positive test would be pain. So injured side now. Again, this is lateral epicondylitis. So again, try and force him into a flexion of the wrist.
Don't like that.
Don't like that? Alrighty. That's a positive. Ulnar, or the ulnar side now for medial epicondylitis. We're trying to force him into extension.
I don't like that either.
Alrighty. So
Ooh.
he tested positive then because of pain for medial and lateral epicondylitis. That is all.